Unfortunately, there is still huge disparity between female survival rate following a cardiac arrest and male survival rate. And that's due to a few reasons. First of all, when a woman, particularly a postmenopausal woman, has a heart attack, they don't tend to have the classic symptoms that people associate with heart attacks. So with a man, you think of the crushing chest pain. With a woman, very often, they don't have chest pain at all, or if they do, it might be something like toothache, it might be ache up their arm, it might be something that feels more like indigestion. However, please focus on things like pale, cold, clammy, feeling sick, feeling thirsty, a sense of impending doom. They are feeling iller than they've ever felt before, and it's frightening. So listen and be in tune to those. It could be that they're having a heart attack. If they are having a heart attack, you want to help them to sit into a lazy W position with their knees bent up, just to give them a little bit of extra blood to their heart. Upright against a wall, so you've got something underneath their legs and they're supported like this. If they have got a history of a heart condition and they have a GTN spray, they should take that. If that doesn't work and they've got an aspirin that they've been prescribed, a 300 milligram, then they should take that and they should chew it. Get an ambulance on the way and they will come and do an ECG and see what's happening. Shockingly, 25% of women don't have a defibrillator used on them in public. Now again, this could be for many reasons, but a lot of it is to do with breasts. So people are worried about exposing a female's breasts in public, and particularly if she's unconscious and being accused of doing something they shouldn't. Give please get over this, because women are dying as a result. So, a couple of things to explain. You can give CPR if somebody has breasts and if they are wearing a bra. You can give CPR and push down on the chest and be giving compressions with them wearing that. You can use a defibrillator and ease the bra out of the way. Or, for goodness sake, she's unconscious, she's not breathing, you're doing your best to help, and if there is a pair of tough cut scissors there, you would cut through the middle of this, it would come down, and then you've got much better access. So I think if you were to ask anyone, or certainly most people, if you would sooner that they had a chance to survive and have a decent quality of life or not, then the answer would be absolutely. So, when you are using the defibrillator on a woman, you are not going to put the pads directly onto breast tissue. That's fine, because actually we don't have breast tissue under our armpits. So you would just move the breast away and stick the pad up under the armpit, so on this side. And the other pad goes up on the top here. And again, you haven't got breast tissue there, so it's not a problem. You can ease the bra down, so you can just pull it down, if that's easiest, and pop the pad under here. So you're going to have one on this side, just under the armpit. So as close under the armpit as you can. And the other one is going to go up on the shoulder here. So that is how you would put the pads on, and then you have complete access like that. But I would strongly urge you not to be worrying about it. You can use a defibrillator with an underwire bra. You're just not putting the pads on top of any metal. The same if anyone's wearing any jewellery. You don't need to faff around taking it off. Just move it away and don't put the pads on the top. I hope that's helpful. Right. Thank you for listening. If you found this helpful, please share with others. We have a wealth of free resources on our websites, www.firstaidforlife.org.uk and onlinefirstaid.com. You can also subscribe to our channel.